Hello and welcome to my channel. In this lecture we'll continue our talk about the thigh. Today is the anterior and medial muscles of the thigh. So let's begin. The anterior femoral muscles, tensor fasciae latae muscle and the Sartorius and the rectus femoris act both on hip and hip and knee, while the vastae medialis, lateralis, and intermedius and rectus femoris act on the knee. And there is also another muscle called the articularis janu, which acts on the synovial membrane of the knee. The tensor fasciae latae muscle, this is the muscle on the lateral side of the thigh in the gluteal region, most anterior part of the gluteal region, originates from 5 centimeters, the first 5 centimeters of the iliac crest, starting from the anterior superior iliac spine till the tubercle, and it's completely enclosed in the iliotibial tract, so it acts on the iliotibial tract. The iliotibial tract is considered the tendon of this muscle. By pulling on the iliotibial tract, it fixes the knee when extended and fixes also the pelvis on the femur. The muscle itself flexes hip and extends the knee. The nerve supply of the muscle is the superior gluteal nerve L4 and 5. So this is the tensor fasciae latae muscle, and you don't find it in dissection unless you cut the deep fascia or the iliotibial tract envelope that encloses the muscle. The Sartorius muscle arises by tendinous origin from the anterior superior iliac spine and area and slightly the area below, and descends in an oblique fashion, as you can see here, and goes to the upper part of the medial surface of the tibia. In front of the insertion, it inserts by a common tendon with the Gracilis and semitendinosus muscles. It's the most anterior of these muscles and sends an extension to the capsule of the knee joint. It's classified as muscle of straight fibers, and the relations of the muscle, the medial border forms the lateral boundary of the femoral triangle, as you can see here. This is the femoral triangle, okay? Forms the roof of the subsartorial canal or the adductor canal. Here it forms the anteromedial wall of the canal, because the anterolateral wall is the vastus medialis, and it's considered the roof of this canal. By pulling on this muscle, it flexes the knee, produces abduction and lateral rotation at the hip joint. It's the muscle you use when you cross your legs. The nerve supply is the femoral nerve. The quadriceps muscle, muscle of four muscles joined together by a common tendon, called the quadriceps muscle. It's formed of the vastus lateralis, vastus medialis, rectus femoris, and vastus intermedius beneath it. When we start by the rectus femoris, it's a bipinnate muscle, as you can see here, and don't be surprised if for example, in an MRCS exam, you were asked about the direction of the fibers of the rectus femoris. Is it upwards and medial or upwards and lateral? Don't be surprised, I got this question in an MRCS exam. The British exams stress on these details. It has a straight head that comes from the anterior inferior iliac spine, and a reflected head that comes from the superior surface of the acetabulum. and it joins the straight head and forms the rectus femoris muscle, and it's the most superficial of the quadriceps femoris muscle, as you can see here. The tendon of the rectus femoris forms the top layer of the quadriceps tendon. We will discuss this soon. Vastus lateralis muscle arises by aponeurosis from the intertrochanteric line. This will lead you to the lateral lip of the gluteal tuberosity on the back of the greater trochanter, trochanter of the femur, and proximal half of the linea aspera and lateral intermuscular septum. It inserts by a flat tendon to the base and lateral borders of the patella, as you can see here, base and lateral borders of the patella, and has an expansion to the knee capsule and also to the iliotibial tract. Together with the vastus medialis, it forms the middle layer of the quadriceps tendon. So the layer on top is the rectus femoris, then in the middle are the tendons of vastus lateralis and vastus medialis muscles. The vastus medialis muscle, this muscle, is from the distal part of the intertrochanteric line that leads to the spiral line on the back and the medial lip of linea aspera, and then the proximal part of the medial supracondylar line. It inserts in the quadriceps tendon together with the vastus lateralis as the middle layer, and by fleshy fibers, please pay attention to this, by fleshy fibers to the medial side of patella. Now, why is that important? It inserts by fleshy fibers in the medial part of patella. To have a direct pull on the patella medially to prevent its displacement laterally, because as we learned before, the femur does not go straight down. No, it goes with an angle, 7 degrees, about 7 degrees from the midline. So the pull of the muscles attached to the femur will be directed upwards and lateral. So that's why we mentioned this before, with the lateral condyle of the femur is more anterior than the medial condyle, and the vastus medialis muscle pulls on the medial side of the patella. Because of this fleshy insertion, it makes a fullness at the medial side of the knee, and it's one of the regions examined for malnutrition or muscle atrophy, together with the deltoid muscle. In malnutrition, the bulge of the muscle, the bulk of the muscle will be reduced together with the deltoid, and this is one of the areas you look for if you are suspecting malnutrition or atrophy of a muscle. The vastus intermedius, this muscle, the vastus intermedius, takes from the upper 2/3 of the anterior and lateral surfaces of the shaft of the femur, descends and inserts in the quadriceps tendon. It forms the deepest layer of the tendon. So the rectus femoris on top, the vastus intermedius at the bottom, and vastus lateralis and vastus medialis in between. Okay, please pay attention to this. Now, in the deep aspect of vastus intermedius, may give the articularis janu muscle. The articularis janu arises from the shaft of the femur, but it may be part of the vastus intermedius. The quadriceps tendon, this is the quadriceps tendon. Don't make the mistake to name this as the quadriceps tendon. No, this is the quadriceps tendon, and this is the patellar tendon or ligament. Okay, although they are continuous and the patella grew in the tendon, but the quadriceps, the quadriceps tendon is meant to designate this area only, this part of the tendon, and the patellar ligament is the lower part that attaches to the tibial tuberosity. The patella is a sesamoid bone. It's the largest sesamoid bone in the body and attaches to this ligament at the apex. And from the sides, as we will study in the knee joint, it forms the patellar retinacula. We will discuss this with the knee joint. Bursa, there are bursae around the knee. One of the bursae is the suprapatellar bursa. This is the suprapatellar bursa. So if in an exam and in a specimen of a knee, if you're asked about this space, this is the suprapatellar bursa. The synovial membrane of the knee protrudes upwards in this area, and the articularis janu is attached to it. This is the suprapatellar bursa behind or deep to the quadriceps tendon. The deep infrapatellar bursa, which is this area, is deep to the patellar ligament. Okay, this is the deep infrapatellar bursa. The superficial infrapatellar bursa is under the skin, anterior or superficial to the patellar ligament under the skin. The prepatellar bursa is here. So remember the suprapatellar bursa and the deep infrapatellar bursa. The articularis janu muscle, the muscle we talked about, arises from the lower part of the femur or maybe part of the vastus intermedius and descends to attach itself to the upper recess of the synovial membrane of the knee. Why does it do that? Because in flexion of the knee, the synovial membrane will be pulled down. Now, when you re-extend the knee, the synovial membrane, if it's kept down, it will be tucked between the patella and the femur, the articular surfaces. So the articularis janu pulls on, together with the extensors of the knee, pulls on the synovial membrane to protect it from getting torn between the patella and the femur. Okay, nerve supply of the quadriceps muscle is the femoral nerve. Action of quadriceps muscle, extension at the knee joint. Rectus femoris also flexes the hip because it arises from a point above the axis of the hip, so it acts on the hip. Lower fibers of vastus medialis, as we discussed before, prevent the lateral displacement of the patella during the action of the quadriceps. Okay, now the medial femoral muscles. The medial femoral muscles lie between the flexors and the extensors of the knee. They all cross the hip, so they act on the hip joint, of course. Gracilis muscle prolonged beyond the knee, so expect to add an action on the knee for the gracilis muscle. The gracilis, pectineus, adductors, longus, brevis, and magnus are the medial femoral muscles. Now we'll start with the gracilis muscle. It's the most medial muscle. The gracilis muscle is the most medial muscle. Arises from the medial margin of the lower half of the body of the pubis. Tapers down, that's why in a graceful manner, that's why it's called gracilis muscle. Tapers down and joins the aponeurosis formed by the SGS, the Sartorius, Gracilis, and semitendinosus. So it's between the Sartorius anteriorly and the semitendinosus posteriorly. The nerve supply is by obturator nerve, and the action, because it passes the knee, it flexes the knee as well as it adducts the hip joint. Okay, so remember this about the gracilis. Remember the action on the knee because it passes the axis of the knee. The pectineus muscle, this is the pectineus muscle. If you dissect it, it's a quadrangular in shape and attaches to the pecten. Remember the pecten on the superior pubic ramus, the area between the iliopubic eminence and the pubic tubercle. It inserts, between the lesser trochanter and the linea aspera, and maybe a bilaminar muscle. That's why it has a double nerve supply. The nerve supply is femoral nerve and an obturator nerve. So the pectineus, don't forget that it is supplied by the femoral nerve and the obturator nerve. The relations of the pectineus: anteriorly there is the fasciae latae of the thigh, separates the pectineus from the femoral vessels and the great saphenous vein. Posteriorly, it's related, as you can see here, to the adductor brevis, anterior branch of the obturator nerve, as you can see here, the obturator externus, and related to the capsule of the hip joint. Laterally, the medial circumflex femoral, this is the medial circumflex femoral artery and vein, as you can see here. And the psoas major, this is the iliacus muscle together with the psoas on its medial side. So it's a relation to the pectineus muscle. Medially, lateral margin of adductor longus. Okay, the adductor longus is reflected here. This is the adductor longus muscle, is a medial relation to the pectineus muscle. The action of pectineus, of course, it's flexes and adducts the hip joint. Flexes and adducts the hip joint. The adductor longus muscle, this is the adductor longus muscle, rise by a round tendon from the angle between the pubic crest and the symphysis pubis. That's why it bulges to the medially when we move the thigh, so you can palpate the tendon, and this will lead you to the pubic tubercle. For example, if you're examining the patient for hernia in the scrotum, you will find a guide to the pubic tubercle, which is the tendon of the adductor longus muscle that protrudes. This is the tendon that protrudes. If you abduct your thigh, this tendon will protrude to the medial, protrude medially, and you will feel it. It's a hard tendon. Inserts by aponeurosis to the medial lip and middle third of linea aspera, and relations of the muscle. Anteriorly, do not forget the spermatic cord. The spermatic cord is an anterior relation of the adductor longus, and the fasciae latae separates it from the great saphenous vein, and distally it's related to the femoral vessels and Sartorius. Okay, femoral vessels, as you can see here, anterior relation, and Sartorius. And actually the adductor longus is between the femoral artery and the profunda femoris artery. Femoral artery superficial, profunda femoris artery deep to the muscle. Okay, medially it's related to the gracilis muscle. This is the gracilis muscle, laterally related to pectineus muscle. The action, it adducts the adduction at the hip joint, and nerve supply is by the anterior branch of the obturator nerve. The adductor brevis muscle, it's triangular in shape. This is the adductor brevis muscle. Brevis means short or small. It arises from area between the attachment of Gracilis and obturator externus on the inferior pubic ramus. Inserts between the lesser trochanter and the linea aspera. Relations: anteriorly it's related to the pectineus, to the adductor longus, to the anterior branch of the obturator nerve and profunda femoris artery. If you don't be be confused by individual relations of muscles, but if you grab the whole thing, you will find it makes sense. They all complement each other. So it's related anteriorly to the pectineus, the adductor longus, anterior branch of obturator nerve and profunda femoris artery. Posteriorly, it's related to the adductor magnus, This is the adductor magnus muscle and posterior branch of obturator nerve. Okay, the nerve is not present here. Anterior to it is the anterior branch, posterior to it is the posterior branch. The proximal border is related to the medial circumflex femoral vessels, obturator externus and iliopsoas muscles. Distal border is related to the gracilis and adductor magnus muscles. Usually it takes from the anterior branch of obturator nerve, and if not, it takes from the posterior branch. Action, it adducts the thigh. This is the adductor brevis muscle. The last of the adductors is the adductor magnus muscle. It's the biggest adductor. Arises from inferior pubic ramus. As you can see here, you know, the fibers arise from the inferior pubic ramus in this direction. So from anterior to posterior till it reaches the ischial tuberosity. The fibers arrange themselves, you know, the upper fibers are the most anterior fibers, and then as you go back, the fibers are oblique. As when you reach the ischial tuberosity, the fibers are almost vertical down. Okay, this is called the ischiocondylar head. So it takes from the inferior pubic ramus. Fibers are horizontal, almost horizontal, and sometimes it's classified as a separate muscle called the adductor minimus. Then from the ischial ramus backwards, the fibers are oblique till you reach the ischial tuberosity. The fibers that arise from the ischial tuberosity are almost vertical, and it's called the ischiocondylar head of the muscle. It has a different nerve supply than the rest of the muscle. The muscle, the adductor magnus, has 4 openings in it because for the passage of the perforator arteries of the profunda femoris artery. We will discuss this later with the vessels. And it has an opening, a big opening downwards at its end. You know, it inserts in the adductor tubercle as well. Between it, the insertion at the adductor tubercle and the shaft of the femur, there is a triangular gap in the muscle that allows for the passage of the femoral vessels backwards to become the popliteal artery. The femoral artery passes in the aperture, the lower aperture in the adductor magnus, and becomes the popliteal artery. Okay, together with the femoral vein. This is called the adductor opening. So remember, it has openings for the perforators of the profunda femoris artery, and opening for, or aperture for, the femoral vessels downwards, you know, before reaching the popliteal fossa. Okay. The relations of the adductor magnus. Anteriorly, it's related to the adductor longus. The muscles here, they are dissected. Adductor longus and brevis, pectineus, posterior branch of obturator nerve, femoral and profunda femoris vessels. Posteriorly, it's related to the sciatic nerve at the back, sciatic nerve, gluteus maximus, the biceps femoris muscle, semitendinosus and semimembranosus muscles. The upper margin of the muscle is with quadratus femoris, and between both is the branches of the medial circumflex femoral artery. The medial border of the muscle is related to the gracilis muscle, sartorius, and fasciae latae. Okay? The nerve supply of the muscle is obturator nerve for the pubic fibers and the ramus fibers, and the ischiocondylar head is supplied by the tibial nerve. Please do not forget this. So the tibial nerve supplies the ischiocondylar part, the vertical part, and the obturator nerve supplies the rest of the muscle. Now, the action of adductors, the muscles we studied, is adduction and medial rotation at the hip joint. Okay, this concludes our talk about the anterior and medial femoral muscles. I hope you got the maximum benefit from this lecture, and thank you very much for watching.